panel with diverse background from various corners of the world. We have companies from European region, then American region. So we'll get to know a lot about healthcare in this session from our esteemed panel. And then before we get into the topic, I wanted to reflect on how India has evolved over the years. Be it e-commerce solutions for US-based retail organizations, payment gateways management for APAC companies, claim platform management for healthcare firms. What is common in all this as we are evolving? All these are great GCCs set up in India, supporting their parent companies to create that impact. And then what we have seen in last couple of years, the evolution of GCCs. Adoption has improved significantly. There is a lot more acceptance from the entire globe to leverage India for GCC capabilities, and hence innovation is growing. That is where GCCs are adding a value in larger ecosystem. But then spoiler alert, for Monday blues, only one solution is there, that is coffee. That has not changed with any innovation yet. With this, we'll get into conversation with our panel. I'll start with some of the questions. Before we get into details, maybe first question where we all can share our point of view. We'll start with Prasanna. Question is common to all of you. Strategic impact of technology in healthcare. How technology is evolving, how GCCs are contributing to create more innovative solutions for our parent companies.
Good morning, everyone. Hope you can all hear me okay till the end. Thank you so very much for the kind introduction. Alright, so before I get into this quick question, obviously content which everyone would have read, and I think this is a futuristic picture of how things could look like in future, and this could be reality. I think this story is about one customer actually ordering pizza over the phone, and then I'm sure it will start reflecting. So what exactly happens is this person starts to order, based on the certain information keyed in by the service which is taking the pizza order, and then after entering the phone number, after entering the address and a lot of other logistics, this person starts to count, you ordered the pizza last time, 6 months ago or 3 months ago. Now the customer still wants to order the pizza, and then after some time, the person says, no, this type of a flavor of pizza is not good for you because this has a lot of calories or this has a lot of cholesterol. You already have a cholesterol, our systems of record show that. The customer still wants to place an order, and after some time says, Pepsi and Coke. No, absolutely you can't because you are diabetic, of course. Now after some frustration and all that, the customer actually hangs up the phone because he's no more interested in talking to the guy. What exactly I'm trying to allude here is, the kind of systems and the kind of technology that we are evolving towards, how exactly these systems could be integrated with each other, which could actually indirectly or directly take care of your health, because what the person who's taking the pizza order is trying to do is trying to caution this person that you should not eat this, you should not eat this because of healthcare. But obviously customer is held back from just eating the pizza, give me my damn pizza. But I think this is where we are heading towards from a healthcare innovation, and how the systems are integrated and how technologies are going to be playing a role in future. 2 bits before I hand it over to my other panelists on the future. See, why GCCs are uniquely positioned in terms of healthcare innovation, even though technology is available to everyone in the world, is first of all the strong skill set from an engineering domain knowledge perspective which sits in India, the kind of knowledge or the talent we are churning it out, which is positioning GCCs in a very unique way from creating the innovative solutions. And nobody can take the points away from the second fact, the strong collaboration and startup ecosystem which exists in India. Now you put together the skill, the workforce, the talent, and the startup ecosystem, the recipes, of course, great solutions in the area of AI/ML, great solutions in the form of AR/VR, great solutions in the form of automation and how certain things can be done better for the future, absolutely. So this is what I would envision, and again we will get a little deeper, that I will continue to keep these 2 points in front of me, that the talent, the strong workforce and the ecosystem of startup is what is driving GCCs uniquely in a pole position to take the whole healthcare innovation forward.
Great example, Rajesh, that pizza one. I think we all can relate to it. Prasanna, how do you? Sure.
Thank you. Good morning, and I completely agree with Rajesh. But I'll also maybe take a minute to reflect on what we discussed this morning. So we were discussing that maybe when it comes to GCCs, especially in the BFI space, I think they are much more mature and much more, say, at the forefront of innovation. Whereas pharma, I think we are still getting there. But when I look at, say, the next, say, 5 to 7 years horizon, I think we will be there. There are a couple of things that are happening in the industry. So one is the GCCs which are based out of India. Now they are, I think, part of the whole drug discovery and development value chain. It's end-to-end that we are doing. And the second thing, pharma companies are also becoming more open to adopting these technologies end-to-end. And then, as Rajesh rightly said, I think the talent is available here, the ecosystem is there. I'm sure it's going to mature much more and things will move very fast. And where we are going to use these technologies, I think, of course, we are going to start mainly maybe initially with productivity, quality, compliance, but more so with innovation part going forward.
Thank you. Echo the sentiments of the two of you, and thank you. Pizza example, it's easy to relate when you give examples like pizzas and all that. You quickly understand the point there. So I completely agree with what you're saying, especially about the life cycle of healthcare GCCs versus BFSI, I think, which are a little bit ahead. But pointing or going specifically to the question that you asked about strategic impact that GCCs can have over the next few years, two perspectives. One is contrary to BFSI GCCs, like you said, which are way ahead in the value chain or contributing at a completely different level. In the field of healthcare, a lot more needs to be done in terms of technology penetration for solving the problems. For the limited number of diseases for which drugs exist in the world, there's probably 10 times those many where drugs do not exist or efficacy levels is not where it needs to be. So one place where I see next 5 to 7 years a huge amount of improvement or next level happening is penetration of technology for more effective and efficient drugs to take charge in a variety of areas. Those that exist, more efficient; those that don't exist, drugs to be built out there, number one. Number two, which I see is, for a large part, and this morning we were talking about the hype of technology translating to reality. I see a lot of, so Gen AI, I've never been to a conference where Gen AI is not used over the last 1 year or so. I see many of these hype things taking a little bit of backseat and reality hitting a little bit more strongly over the next 5 to 10 years with solid business cases that can fructify taking charge in general GCCs, but healthcare GCC space. And the third thing that I see is a stronger focus on value, which is driven by rock solid KPIs. It's one thing to say adding value, we spoke a little bit about value, but if value cannot be measured super strongly, then technology will remain just for technology's sake. So I see those three as critical values in terms of strategic value that technology can add to the organizations, and GCCs are uniquely positioned to do that.
Great insights, thank you. So maybe a follow-up question on Rajesh's point, which he highlighted on collaboration. So Rajesh, very specific question to you on collaboration for innovation. What do you think how GCCs can collaborate with larger ecosystem within India, be it R&D institutes or startup ecosystem, to collaborate more to create that value? And also, from your experience, have you seen any specific collaborative models which have yielded good results for you?
No, absolutely. Now, I think again, two key words that I keep hanging on to, again, talent and ecosystem that we spoke about. Now, I think in the past, where the GCCs were sort of evolving and transforming, we know that it was all about work moving to India, because obviously there was no engineering and talent was there, but obviously the domain knowledge was not there, and the larger collaboration ecosystem was not there. Platforms like this where people could share the best practices, where people can co-create and coexist together, because everyone was trying to find their feet on how to open up a GCC, how to survive a GCC, obviously from an executive sponsorship perspective, and then continue to justify the value of GCC as we were discussing, backstage also. So I think the fight was all about existence and survival. Now, over the period of time, more and more GCCs opening up in similar domain and the other domain. Technology partners, many of us, many of the people in this room, and the domain knowledge which is being created by GCC over the period of last 1 decade or 2 decades. Now that is starting to show how platforms are like this are obviously bringing people together and then say, I have created something, why do you want to reinvent the same way? Let's co-create. Or you leverage my platform, I leverage your platform, and let's create two separate sort of value chains for the GCC or the main parent headquarter company. So I think that over the last few years, and post-COVID obviously most importantly, the mind shift and the overall meter has shifted in terms of how company, the GCCs and the organizations are coming together to co-create and collaborate, of course. And the startup ecosystem, absolutely. There are so many sort of startups are running in the basements of the company, looking forward to come out, and the GCCs are tapping into those startups and obviously making sure they see the day of the light, and obviously a lot of innovative products are coming at a very economical cost, because obviously cost is always a factor in the beginning, right? And we will get a little deeper on that as well. So that obviously in my mind has played a very crucial and pivotal role in terms of how GCCs naturally are going up, startup ecosystem because of the whole motivation is going up as well, and that is creating a value for the parent headquarters. And I will share one, without quoting too much, my own example here. So we are a consumer healthcare product company, from a J&J point of view that we just got spun out. Now our focus is, and we are getting into a little bit of a startup discussion also, how exactly we can make the right healthcare product, including some medicines and other essential healthcare, available to the customer so easily across multiple channels, across a lot of other ecosystem from an omnipresent point of view. Most importantly, keeping in mind the data security, patient healthcare information, obviously, because that is very important to all of us as well. Now, a lot of these things you cannot boil the ocean yourself. You need collaboration, you need some ready-made solutions, and obviously you need some solutions that you can put your own IP on top and actually create the value for the parent organization. So I think a lot of these things coming together obviously is creating an environment where obviously GCCs are now showing and leading the path for the parent organizations.
Raja.
Yeah, no, thank you. That set the base for a good conversation. I mean, I see innovation falling in 3 buckets and collaboration models changing as we move through those buckets. And I'll probably substantiate with an example. Let's assume you want to know what whether you're a diabetic or no, and if you're a diabetic, what your current scores are. If suppose the tool that's available to you is to prick your finger all the time and then see what the score is, and then it shows you, oh my god, your current score is XYZ, whatever be the case, I'm not using technical terms. This is solution number 1 that you have. One innovation, which I call as incremental innovation, is the same reading that you got by pricking your needle all the time. Suppose you have a watch like this one, which doesn't prick you, but shows you the same reading with a little bit higher or lower accuracy. Remember, the product is the same, and the products are a little bit different, but kind of same thing. It achieves the same goal. It shows you what the reading is and all that. This is an example of incremental innovation. I think this can be done in a COE, Center of Excellence, within your own organization. You probably can have an innovation team and all that, then that makes its way into the product backlog and all that. And then you probably then need to ensure that this product hits the payers and the insurance providers and all that. Relatively small ecosystem required, relatively less collaboration with the external stakeholders. Now let's say case 2, an organization decides, no, we want something more than that. And they say, let's have something like an insulin pump itself here. This one does something more. It can give you the same reading, no breaking and all that, or probably a little bit mild break. It not only does that, it gives you the reading and it goes a step further. It can pump insulin into your body if you're a diabetic, and if you're not a diabetic, but you're a pre-diabetic, it will not, it will show you, hey, something is about to happen. Go ahead and put it before you get into a danger zone and all that. This one is not incremental, this is adjacent innovation. You've gone one step further. You've taken the adjacent space of not being reactive, but proactively wanting to administer and all that. In an innovation like this one, you need a bigger ecosystem. You probably need the payers and all that, because they need to pay for this particular product and all that, but you need research institutions which are able to substantiate with a huge amount of data. You need consulting companies which are able to work with you to take this particular thing, show where it stands. You need service organizations or product companies which can ramp up quickly, build something for you, or products which are not intellectual property while you keep the IP with yourself. You need IP providers and all of those things which can help you patent this very, very quickly. We are now talking about a much more different and bigger ecosystem. And the last example is disruptive innovation. Same diabetes case, you have a continuous glucose monitoring CGM device that sits somewhere on the arm or somewhere. It's built in, it automatically checks the diabetes reading every minute, hour, whatever. You don't know it's checking. It doesn't ask you. It pumps the insulin at the time which is appropriate, as much as required, without even asking you. You go about your day normally. This is a disruptive innovation in completely different league altogether. You don't know, you don't need to do anything, you don't need to be proactive, you don't need to be reactive, you don't need to be the mix itself. This one is way more advanced. Here the innovation ecosystem is even more advanced. Exactly you said you need startups because they usually are in the disruptive space very often. In addition to startups, you need academia because you need some professors and the PhD people to join you to pick up what's available here to take it to the next level. This is called hybrid innovation. You obviously need the players from the previous example I gave you. You need to have some other stakeholders, particularly you need the government. You need to have the local ecosystem from the government in place to provide you the kind of support which is required, thereby ensuring that you don't get copied very clearly. You need this to be taken to different countries because such innovations cost millions, billions of dollars. You need to be taken to different places. So you see, same example of diabetes, depending on is it an incremental innovation, adjacent innovation, or disruptive innovation, the ecosystem keeps on changing, growing and all that. And like Ajesh mentioned, ecosystem is the most important. At Roche, we value it enormously and feel its role is vital. So thanks for putting this event together where we have the ecosystem partners coming together. So that's a long answer, but hopefully it explains the
great summary, Raja, as you said. Not that for each innovation I have to go and leverage ecosystem. How I can leverage COH within my ecosystem versus how I can leverage my ecosystem to create a disruption in my environment. But another aspect which I really want you to touch upon, Raja, is as we are innovating, balancing between cost and innovation is equally important. You can't keep doing research all the time. So what is the best way in your mind to create that right balance between innovation and cost management?
It's a great question, and I have a slightly opposite perspective on the whole question. How can you even manage cost without ecosystem? I would reverse the question out a little bit, because if you keep ecosystem static, innovation static, your cost that the customers will pay you keep on decreasing year on year on year. Your internal cost is the same. So your price keeps on going down, your cost stays the same. Pretty soon your margins keep shrinking. So innovation, there's no option. It has to be done. One of the three, potentially all three of them, depending on what stage that you are. So the question that you asked, I'll turn it a little bit to say, how exactly can you sustain innovation while ensuring that the funds available for R&D are used in the most efficient way? It's very easy to have a huge R&D budget, and we have one of the largest R&D in the space that we are in, probably the largest R&D budget out there in the world. It's very easy to not use it efficiently, use it on things, for example, which sound disruptive but are simply incremental. Tons of money is lost in what you do with an incremental innovation, or potentially something that gets killed after a lot of years, and drug discovery takes a lot of years, and then you lost it also. Frugality in innovation and using the money in the most efficient way is a crucial skill. Here is where GCCs play a role. One of the reasons you start GCCs amongst many others is the cost benefit that it provides. So critically, we are at the right summit right now. The presence of GCCs provides that kind of benefit in ensuring that cost management thing comes in. Second, something we were talking backstage also is one thing to say value. Second is value measured by KPIs, which are very strongly put together. That brings a physical discipline, and now innovation sticks to certain things. For example, you don't know how many steps you walk today, but if you had a gadget which tells you walked only 5,000 steps, and you know what, this hour you were supposed to have 20 steps more. You are much more controlled in terms of how you do things. Equivalent of this when billions or billions of dollars is available in innovation. That KPI is the second thing. So first is ensuring that you use the funds correctly. Second is this, and the third is discipline in saying no. It's easy to say yes to every fancy sounding innovation. That is hype. It's right to say no to a lot of things, wait and take time, and say yes only to the right things. If this discipline is cultivated in an organization, you end up using the money that you have in the most efficient way possible. And that answers the question. So the combination of all these things, how I see innovation balancing on the fiscal prudence aspect, etc. And GCC, India is a country with Jugaadu innovation. It had all the wrong name, but trust me, used correctly, it is a wonderful system, and used these brains of the Indian stakeholders and GCCs used correctly, it can really create the kind of ecosystem required. That's why GCCs are present highest in India also. So that's a long answer, but hopefully that answers the perspective.
That answer very precisely.
If I can add a couple of points. Fantastic pointer, but I have a couple of more pointers as well. Now, one is obviously, being a new GCC, obviously, I have to have an innovation charter, but obviously, the first priority is setting up GCC capabilities, and the rest of the required stuff that needs to happen. So funding is obviously not there, or there, of course. So the principle, and obviously some of the guiding things that of course I'm trying to do, and I think this a lot of people will resonate, is first of all, prioritize. You may have a laundry list of a lot of things that you would want to create from an innovation, the charter, but what exactly you want to prioritize, which has a lot, the biggest impact, coming at a very nominal cost, for example, and the ROI is higher because everyone is looking at KPIs, absolutely right. But that is where the first thing is prioritize what you want to do with an impact and cost in mind. Second thing is again, leverage the existing ecosystem. Don't reinvent the same wheel again.
Very important.
Exactly. So, this is where we all GCCs internally have to understand. We may be competitors to each other in the business side of things, but internally we are co-creators. We need to be leveraging, gentleman on the next level, of course, is creating, or the next organization is creating, and how we can actually leverage without jeopardizing the IP, without jeopardizing the data and the rest of the other stuff. How we can actually take that principle and do that. Third is, you mentioned about academia. Obviously, that is most important as well. Engage those because these are research mindset people. These are the people with a lot of passion, energy, new way of thinking, and these are the consumers of a lot of those innovative products as well. So engaging them. And fourth most example is lean innovation. You mentioned that again. Incremental, that is most important. Do that in MVP, do that in proof of concept or POC kind of a way, and then build on top. And then once you start to show that value, then obviously getting funding for the larger part is important because then there is something which is working on the ground that is important. And now AI, absolutely, you can cut down the whole innovation process. If you have a good amount of data, you have a right skill to churn that data, you can automate a lot of parts of the innovation, you can cut down, you can streamline the process, and what innovation used to take a few months or a quarter or a year, obviously can be cut down because the processing power and the data can actually tell you what to do and what not to do and what could potentially be a good prescription for an innovation coming out. So this is what I'm trying to do in my new GCC, of course, so setting on top of what just I said.
Thank you, Rajesh. Okay, now we are talking about healthcare, we are talking about innovation, but for whom? For our members and for patients. They are the center of all this innovation for healthcare companies. So, Prasanna, question to you: how we can enhance patient care with all this innovation, specifically by leveraging technology? Some of your thoughts.
I think, as Rajesh mentioned, technology could be a big game changer. Maybe I'll give one example. I think Raja gave this example of glucose measurements. Just continuing on that one. So, based on glucose measurements, so the physicians, they decide the insulin dose and adjust dose. But most often, they were not having these two data points at the time of decision making. Now, with the help of wearables and also the algorithms that are available, so the physician at the time of making the decision, so they will have glucose sensing data and also the insulin data, and they can adjust. And that leads to better outcomes to patients, both in terms of their, say, diabetes control and also reducing the risk of side effects. So it's just one example of how actually we can use technology, both in terms of, say, wearables and also the algorithms to improve outcomes for patients and also the healthcare systems.
So, Prasanna, follow-up question for you. As we all know, healthcare is a highly regulated industry. Okay, though we are talking about leveraging technology, AI, ML, and all these fancy wearable devices, but then how to navigate through regulatory and ethical challenges more specifically by leveraging technology?
It's a very good question. We spoke about cost and innovation, but actually the most important piece is coming here. Let me give some example and also experience from the innovation lab we set up a couple of years back. Novo Nordisk is one of the mature GCC. We've been there in this space for close to 16 years now. And we set up an innovation lab a couple of years back to make use of the ecosystem here, especially when it comes to digital and data. When it comes to, say, the sandbox, doing the experiments, we were super successful. But when it came to implementing it, the corporate implementation, it's a mixed bag. And why we were not able to take these experiments from sandbox to corporate-wide implementation, I would say there are three things for us it became very critical. One is the data security. I'll give an example later. The second one is data privacy, and third one is some ethical consideration. Let me give an example for data security. So we were working with, I won't say a startup, it's actually a mature organization based out of India. So we spent a considerable amount of time, effort, everything. Then we realized that the quality systems are not enough, especially from a data security perspective, for us to implement it company-wide. And we had to call off that project. And maybe I think, what I feel is that when people are investing a lot in, say, innovation part, are they equally building the quality management systems side by side? Are they investing? So that's where there is a concern. That's about data security. Let me give an So we spoke about diabetes, there are millions of patients, that's a different issue. Let's take an example of rare diseases. Maybe there will be very few patients, and if you take a very small geography, like a very small country, so basically if you don't have good data privacy standards, so basically the privacy gets compromised. So if there are say 200 people in that country with that particular disease, and if you don't have good privacy setup, so they get exposed. So that's the risk. And the third one is ethical challenge. So you spoke about data, what can we do with the data? So we now got billions of data points, but the purpose we collected those data points was for primarily for that the primary utilization was data was different. Now we are trying to do the secondary utilization of the data. And if you don't have good ethical guardrails, I think things can go really wrong.
Use cases for data is growing significantly. So, great point. Okay, so we are coming to the end of this session. Maybe one last question, and if you want to keep it brief, very, very brief, I would say. Future trends in healthcare. What innovative solutions are coming, and what are the future trends that you see in the next 5 to 10 years, which are getting emerged due to newer technologies and emerging technologies?
Absolutely, and I think this is great because this is my favorite from an overall research point of view. I think the technology have already started working on this, but what exactly we are seeing is that there is a personalized and customized healthcare for the individual based on the genetic structure of the individual. And I think there is a lot of research already happened because now, what works for Prasanna or what works for Raja may not work for me because we are all differently DNA'd and we are all differently genetically from a structure point of view. So if there are customized solutions for my healthcare, and again putting a predictive modeling on top, what potentially could happen. And again, this is not to scare the individual. Obviously, that is something may happen to you in 2 years or 5 years, but this is all about proactively what you can do. And this is a customized treatment for you based on what will specifically work for your body. That is most important. Alerting, that Raja mentioned, absolutely is important. And then some life-saving, small little things that can be done to you without even the administration or without even the attention of a healthcare professional. That is where we are getting it. But all of this will make sense only when the data is in the right hands. We are using the data in the right context. And again, I'll close by saying, I was just looking at a small little meme that came from somewhere yesterday. A person is running, a marathon, almost 20-30 kilometers, and then all of a sudden, the watch starts beeping. We have lost 79 kgs. And what happened? He was running through a forest trail, and a bear comes in, eats that person. Only the arm is there on the floor, and the only risk is there. The risk is saying you lost 79 kgs. But is that the right context? No. So the data has to make that context. 79 kgs lost, obviously, without the body or without the life. It doesn't make sense. So everything has to make sense. But obviously, the next generation is all about personalized, customized, and holistic wellness rather than just a physical wellness we are talking about.
Great point, Rajesh.
4 P's is the future of healthcare according to me. P number 1, preventive. A lot of people don't want to fall sick to get the best medicine. You would rather prevent the disease itself. A lot of focus on preventive wearables and all that. People like me wear wearables, nothing to do with health because when you don't have a nice face, you don't have a nice wearable disease. So people like me wear because of that. But P number 1 is preventive. P number 2 is predictive. If at all preventive fails, you would like to predict it 5 years prior. Your lifestyle is telling you you will get into a situation. Number 2 P is predictive. Number 3 P you said is personalized, and the company that I went to, Roche, is a pioneer in personalized, which means you have a fever, Dolo, crocin. Somebody doesn't even see. Nowadays, a 7-year-old child also knows Dolo. Take it, whatever be the case. It doesn't work equally for everyone. So what works for you, like you said correctly, is it doesn't work for someone else. So P number 3 is personalized. When you personalize, it's much more effective for the individual in question. And the last P is called peace of mind. If all of those things are in place and the right caregivers exist, you have peace of mind. You can have the best medicine, you can have the best systems, best insurance, but if you don't have the right emotional support and the right people around you taking care of you, those first 3 things will not work for you. So having the peace of mind and the systems and the social connection place. I think those 4 P's, once again I'll just repeat those things, etc. Preventive, predictive, personalized, peace of mind, I think is the future of the edge, which is healthcare.
Awesome. Great 4 P's. Prasanna, quickly maybe.
I can add one more P, that's point of care. Yeah, that's the point of care. I think definitely both what Raja and Rajesh covered, I think that's going to translate both supported by both hardware and software. But I think what I'm more curious is how it will get translated at the caregiving part. When a physician interacts with the patient and finally that innovation gets translated into an outcome, how it's going to happen. So maybe that's what I'm curious about.
Awesome. With that I can say create 5 Ps. And just to summarize, I think very important point, great insights shared by our panel. Most important learning, particularly for me, is focus on incremental innovations as well. Not necessarily that innovation always has to be disruptive. I think we all need to learn how to focus on incremental innovation, but keeping patient in mind. Point of care is very important, and then personalization is the key. Everybody is looking for personalization in each domain, so we have to take care of personalization in healthcare also. Is very important. Then second, from GCC standpoint, it is very important for us to learn fast, fail fast, and add value faster. So this I conclude the session. Thanks to
The 6th P could be partner.
collaboration is the key. Like obviously, we cannot get a success without partnering with the ecosystem and also leveraging the strength of each